Hello everyone, welcome to our YouTube channel for Nurses Preparation. I am Neeraj Kumar Kaithal. Today we are presenting NCLEX based important questions for upcoming norcet exam 2021. Let's begin. Our first question is, a myocardial infarction client suddenly have tachycardia, signs of air hunger and coughing with fruity pink tinged sputum. In this condition, expected finding while auscultating breathing sound. Just let's explain the question. You are assigning a client who is diagnosed with myocardial infarction. The client suddenly have tachycardia. Tachycardia means heart rate more than 100 per minute. Signs of air hunger. What is air hunger? Air hunger is a drive to breathe very high. Drive to breathe very high while exercising or due to medical condition. Patients want to breathe very high. Patient want to breathe, but he is not able to breathe properly due to medical condition. In this case, signs of air hunger, shortness of breath, labored breathing or rapid shallow breathing. Now he is having fruity pink tinged sputum. What is that? Fruity sputum means sputum is a mucus, and fruity sputum is mucus that contains bubbles and is forming. Sputum means mucus that is secreted by the alveoli of the lungs and we throw it out by the mouth. Sputum is a mucus and fruity sputum is a mucus that contain bubbles and foaming. Now, pink tinged sputum. Pink tinged sputum, what is that? Fluid and small amount of blood leak from capillaries into the alveoli of the lungs. A sputum or a mucus that contain a small amount of blood. The blood come from capillaries of the lungs. The capillaries secrete a small amount of blood to the alveoli of the lungs, and from there that mixes with the mucus and we throw it out by the mouth as a sputum. So I hope you understand the question. Now tell, in this condition, what are the expected auscultating breathing sound? You have four options. First is stridor, second is crackles, third is scattered raunchy, and the fourth one is diminished breath sound. It is a very important question. You can write your answers in the comment section below. Please answer fast. Please click upon the like button. I'm going to tell you the right answer. Now the right answer is option B, crackles. MI client is now having the condition which is called pulmonary edema. After the myocardial infarction, patient is having pulmonary edema. This pulmonary edema is also known as wet lungs. In this condition, patient's lungs have excess accumulation of the fluid. Important signs and symptoms of the pulmonary edema are extreme breathlessness, dyspnea, air hunger, difficulty in breathing, and production of fruity pink tinged sputum. All are found in the client. So we can say the person is having wet lungs or pulmonary edema. So the auscultation sound is crackle sound. This is the right answer. Now I want to tell you another term, that is stridor. What is stridor? Stridor is a crowing sound associated with the laryngospasm or edema of upper airway. Stridor is a breathing sound like a crowing. It is associated in the persons who are suffering with laryngospasm condition or who are having edema on their upper airway. Next question is, MI client developing cardiogenic shock. A client who is having myocardial infarction is now developing cardiogenic shock. What is cardiogenic shock? Cardiogenic shock is a condition in which heart unable to pump blood according to the need of the body. Cardiogenic shock is a condition in which heart is unable to pump enough blood according to the requirement of body. Because of the risk of myocardial ischemia, what condition should the nurse carefully assess the client for? After the cardiogenic shock, patient may have myocardial ischemia. For this prevention or caring reason, what is the condition the nurse should assess carefully in this client? What is myocardial ischemia? Let's discuss it in short. Ischemia means simply reduced blood supply. If the blood supply is reduced in the heart, it is known as myocardial ischemia. Reduced blood supply can cause reduced amount of oxygen to the heart cells, and if this occur, heart cells will die and the person will definitely gonna die. You have four options here. You have to observe what is right. Option 1, bradycardia. Option B, ventricular dysrhythmia. Option C, rising diastolic blood pressure. Option D, falling central venous pressure. What is the right answer? Write down your answers in the comment section below. Please click upon the like button if you think this video is helpful. The right answer of this question is option B. Ventricular dysarrhythmia condition will develop here, and nurse must observe this condition very carefully because it is the initial indicator that patient is going to have myocardial ischemia condition. Option A is the wrong choice because classic sign of cardiogenic shock related with the myocardial ischemia are low blood pressure and tachycardia, not bradycardia. I just want to tell you one thing, that dysarrhythmias are the most common complication of myocardial infarction. Central venous pressure will increase in this condition, not decreases. So this was the second question. You can take a screenshot if you want. Third question is, a client had cardiac surgery 24 hours ago. Client is had cardiac surgery 24 hours ago. Now urine output average 20 ml per hour for 2 hours. Urine output average 20 ml per hour for 2 hours. Then single bolus of 500 ml IV fluid given. 500 ml IV fluid given. Then subsequent hours urine output was 25 ml. Normal laboratory investigations done. According to the report, blood urea nitrogen level 45 mg per dl, serum creatinine level 2.2 mg per dl. What will be the possible diagnosis by observing these conditions? Your options are option A, hypovolemia, option B, acute kidney injury, option C, glomerulonephritis, option D, urinary tract infection. Here the question is very easy, but examiner try to confuse you. If you have cleared your basics, you can directly give the answer. If you know the answer, please write down your answer in comment section. Click upon the like button. Right answer of this question is option B. Patient is having acute kidney injury. Let's see the rationale. Clients who had cardiac surgery is on risk of acute kidney injury due to poor perfusion, hemolysis, low cardiac output or vasopressor medication therapy. Clients who is going to have cardiac surgery is on risk of renal injury because during the surgery, poor perfusion, hemolysis, low cardiac output or vasopressor medications can cause acute kidney injury. Important signs of renal injury are decreased urine output. You can see here the client's urine output is 20 ml per hour. This is not normal. This is decreased. Normally we have the data according to this 30 ml per hour is the normal urine output. You can see this is decreased. And according to the report, person is having blood urea nitrogen level 45 mg per dl, but the normal blood urea nitrogen level is 10 to 20 mg per dl. Here serum creatinine level also increased 2.2 mg per dl. The normal level is 0.6 to 1.2 mg per dl in males. In the females 0.5 to 1.1 mg per dl creatinine level. So we can say the person or client is having acute renal injury or kidney injury. You can take a screenshot. So friends, these are few important questions regarding AIIMS NORCET exam 2021. How was the video? Please give your suggestions or feedback in the comment section below. We are regularly uploading videos for AIIMS NORCET exam. You can watch our previous videos also. If you think this video is helpful, then please click upon the like button, share this video with your friends and subscribe our YouTube channel for nurses preparation for more such interesting videos. All the best.